It is a pleasure to join you here today, and it is an important event that you have, and quite rightly only every 3 years. It's a difficult process to put together, but I'm so glad so many of you do come to support the Royal College of Physicians and Surgeons of Glasgow, and that it is an opportunity to get together in a rather unique fashion, because it really doesn't happen in quite the same way elsewhere. And it certainly does respond to your funders, your founders, and all those who've been part of your membership over the years. To be, I think, as Chief Medical Officer just said, be realistic about medicine, that you're dealing with people, that the individual doesn't see themselves as an organ or a limb or a bit. They only see themselves as people, and this way you tend to maintain that understanding that you are dealing with individuals who do not see themselves in quite the same way as maybe the specialists does. And you've been doing this for 400 years, also based on an ethos of volunteering to set the clinical standards which you know are necessary, not just to further careers, but to make sure that you are establishing standards for the treatments that become available. And more do become available. And that is something that every 3 years you are really looking at some extraordinary step changes in what is on offer. And that direct clinical support towards building those surgical and medical training generally is really important. But your ethos takes you further than that. And that, I think, your links with other countries, with the international members, gives you an added advantage, and particularly those in Malawi. And that is a really good link to have. You mentioned Save the Children. Save the Children's initial pilot programs for the Stop Polio campaign, one of those countries was Malawi, partly because they had a very well-established mother and child centred care system. I have to say the women's section of the party, Dr. Banda's party, also had a considerable amount of control in terms of getting women to go to these centres, which made it even more successful. But it proved what could be done, as it did in fact in Swaziland and in Lesotho. The work that is done, and I share, I've just been to Sierra Leone to see kind of the after effects of the Ebola crisis. And oddly enough, the thing that struck me was that the crisis for them is in confidence in their health service, because people were frightened of going to the health service after a while because they believed Ebola and doctors were closely linked, which in fact was an unfortunate result of that experience. So rebuilding confidence in their health service and the values that it meant for them in the long term has been an interesting exercise. And Save the Children has gone back to its very locally community-centred health service clinics in order to be able to restore that level of confidence. And just recently I've had the opportunity, as being Lord High Commissioner of the General Assembly of the Church of Scotland, to have the chance to bring together people from different volunteering backgrounds. But a lot of those were medical and might seem relevant here to mention. And one I suspect you all know about is the Vine Trust. And some of you may have even volunteered for the Vine Trust in either Peru or in Tanzania. Suffice to say, they have an ability for recycling old MOD tenders into something very much more useful, which is mobile clinics up tributaries in the distant Peruvian Amazon from Iquitos, based entirely on volunteer doctors and medical services. It is an extraordinary achievement, and most of them come from Scotland. So there is a real link there with realistic use of medicine and understanding where to put it. And the one they took to Tanzania had to go not by sea and over land in order to get to Lake Victoria. I can only say that it says a lot for the power of prayer that they got it there at all. But that is now working in some of the islands in the southern areas of Lake Victoria, which had no public services at all. That will be entirely dependent on volunteers, and mostly doctors and medical health workers. One of the other aspects, and this links in with your development here, particularly in e-learning, Swinfen telemedicine, and building up a network of consultants around the world who can respond to very specific issues from areas of countries who have no real specialist knowledge, and to use telemedicine in the broadest sense to be able to get some of these standards applied in countries where you would not have practicing experts and specialists. I'm particularly impressed by that particular organisation because the two individuals who run it are both well past retirement age, but have grasped the concept of IT and the use of telemedicine in a way that a lot of other people have gone, oh, well, that's too difficult. No, if you start somewhere, you can make really good use of your knowledge in places where it wasn't available before. Slightly depends on a power source, that may be a different issue. But the telemedicine, interestingly, with your e-learning propositions coming up, one of the medical schools in London was using it quite early with undergraduates. And when I asked the question about isn't this a little early in their training, they said, well, actually, we've noticed that it makes them ask better questions and it makes them listen better. Because you can't touch the patient or make observations, you have to be really careful about what questions you ask. And you really do have to listen to what the individual is saying to you. So there are some sides of technology which you have probably have more of an upside than we recognised, and e-learning is certainly one of them. The downside from your perspective is that people use the internet in a way just to annoy doctors by turning up with what they think is wrong with them and demanding a cure. I have huge sympathy with that. The internet has been a challenge to a number of professions, and not least of all the medical profession. I suspect it happens less often to surgeons, but practically everybody else is going to suffer from that kind of level of information. And it is important, and it raises the importance of events like this and the Royal College's a multidisciplinary approach and its independent stance to make good sense of that knowledge, to recognise the benefits of volunteering as part of your professional career and part of your development. And in relation to what Chief Medical Officer was saying, maybe the realistic use of medicines and the way in which you approach that. So this conference, Excellence in Healthcare, is timely. It's very broad, but it does kind of demand that approach to the individual and the sort of healthcare that is relevant to them as individuals, rather than just as a patient and just as an issue or just as a specialty. And I think that will be really important. And I don't apologise for asking questions about lawyers. I do think they need to be part of that equation, because it seems that if you're not careful, that will create a divide between you and the people that you want to treat if they don't understand what that relationship is. I hope that it will also encourage you to continue to practice, continue to support health workers at all levels. And I think it's the health workers at all levels which may be key to your realistic medicine. And to involve, as I would say, wouldn't I, as Princess Royal Trust for Carers, to trust those who are carers to be part of your response to conditions of the individuals that they are looking after. That's quite a broad concept, but I'm hugely encouraged when I come up here and to an event like this to really feel that this very multidisciplinary group of people really grasp the importance of what healthcare means to the populations around them. And I thank you very much for that. And I thank you as members and those who give up so much time to the college for driving that continually to keep people connected, to keep people talking, to keep people understanding the basics of good healthcare and the potential that modern technology and advances in science make. So it's a pleasure to join you today, and I look forward to those e-learning opportunities that you are going to create. Pass on even more of your knowledge to a greater number of people. Thank you.